Thank you, Liz. Well, the recent suicides of actor Lee Thompson Young and reality star Gia Elamond has put a spotlight on a problem that few people want to talk about. September is Suicide Prevention Month, and the mental health community is working to erase some of the stigma that may keep people from seeking treatment for severe depression or suicidal thoughts. And joining us now with more is Dr. Gregory Jones, a psychologist in private practice, who is a friend of the show, been in here before this morning. We thank you for coming in.
Thank you very much for having me again.
It was interesting to look at this and you see how big of a problem that we are really having with suicide. It was the CDC that just did a study saying that more people now die of suicides than in car accidents. Why are we seeing such an increase in this?
Well, there are a lot of reasons why we're seeing such an increase. When you have a downturn in the economy, oftentimes you are going to see people having a lot more mental health struggles. So the study looked at data starting around 2010, which is about 2 years into the financial crisis. So the baby boomer generation right now is one of the highest at risk.
So I think I had read too that men specifically kind of in their 50s, that time, that age frame is when we're seeing the biggest increase?
Yeah, men in their 50s are showing the biggest increase. Again, most likely to be impacted by the financial crisis. Also, men are more likely to attempt suicide with more lethal means than women. So men and women usually may attempt around similar rates, but men are more likely to succeed.
And we're also seeing, of course, the impact on the military community as well, which we know with the wars that we have been fighting, that's having an impact as well. So I'm sure all of that with the financial crisis together is having an impact. So I guess the big question is, how can we take the stigma away here so people do get help? It's hard to believe that in this time, 2013, that the stigma is still there.
Unfortunately, the stigma about mental health concerns is still there, but it is very important that you do not take this lightly. If someone is a concern, you want to look for a few things. Some of them are going to be if they stop seeming like they care about things. They talk about feeling helpless or hopeless, saying things like, I just don't care anymore, I have no reason to live. You also want to ask and find out if they have a plan. Sometimes they will actually tell you that, yes, I do have a plan. You want to find out what kind of plan they have. Do they have means to do this? And if so, you want to take action as soon as possible. So if someone you feel might be an imminent threat to themselves, you'd want to call 911. You'd want to get them to the nearest emergency room. If they're not an imminent threat and you want to make sure that they are getting help, please reach out. Contact a local therapist. If they're someone who is more likely to seek religious support, contact clergy. You can also look at going through a school if the person is in school, talking to either a teacher, a school counselor, a trusted adult, but someone that you know that you can reach out to.
What, if it's a friend or a family member, how do you talk with them? I mean, do you say, I think you need to get some help? What is it you say to not make the situation worse, but just realize you're there to help out? What do you say as that person that maybe sees the warning signs?
Well, you really want to be a good listener. Allow them to talk and just feel that they can trust and open up to you. Try not to negate their feelings by saying things like, you have so much to live for. Oftentimes, people will not hear that very well and won't respond well to that. So be open, be honest, be a friend, and really reflect, I think you need help and I care about you and I want to see you happy and being better.
I think it's difficult that people a lot of times still, even then, oh, I don't want to do that. That's for other people, or they see it as a weakness, which of course we know it is not. What do you do then if that person just refuses to seek help from a therapist? Is there any way you can kind of help them along? I mean, what can you do?
There are many ways to help them along. You may be able to say things like, if they're saying it's a weakness, reflect how, I actually think it's strength. Knowing when to reach out for help is a strength and not a weakness. A weakness is more about hiding and not seeking out the support that you need. If you don't feel that you're capable of helping them, reach out to someone who can. They may listen more to a family member, a friend, or another trusted adult in that person's life.
Now, I know we had put up on the screen some of the warning signs. If we could put that back up again, there were some other ones we wanted to mention as well, like increased drug and alcohol
Oh, yes.
use? That's big. Is that kind of something you see very often?
Yeah, oftentimes you will see someone who, when they stop caring, they're trying to numb out their feelings and they will turn to drugs, alcohol. They may also turn to food, so you might see changes in appetite and weight. You may also want to look at sleep and seeing if they're sleeping more or less. So a lot of these are going to be really good warning indicators.
Okay, well, Gregory Jones, psychologist in private practice, thank you for coming in
Thank you
and
very much for
discussing.
having me.
It's such an important topic
Yes, it
to
is.
talk about, and a lot of times, like we said, we kind of scoot it under the rug, but it's good to, hopefully, if someone out there is watching and sees somebody with these warning signs, they can get them help.
Yes.
Thank you.
All right, thank you for having me.
All right, and if you or someone you know needs help, you can also call the National Suicide Prevention Line. That number on your screen, if we could put it up there, is 1-800-273-8255.